before doing this procedure, first things first is I would go ahead and have my proper personal protective equipment if indicated, and I would also have checked the order to see if the patient did need a catheterization. So first things first, I would go ahead and knock. I'd come in, I would go ahead and close the curtain and introduce myself. Hi sir, my name is Acacia. I'm going to be your student nurse for today. And then first I'm going to work on the other side, since I am left-handed, so I want to work on my non-dominant side. So after I introduce myself, I would go ahead and first identify the patient. Sir, could you, and I would check it on both arms because you never know where the ID bracelet is going to be. So I would first ask the patient, sir, could you please tell me your full name and date of birth? So the patient would confirm say his full name and date of birth, and then I would confirm it. All right, thank you, sir. And then I would go ahead and ask the patient, sir, are you in any pain today? And if the patient was in any pain, I would have waited 30 to 45 minutes before performing this procedure because I would have given him some medication to help with the pain. But since he's not in any pain, then I would go ahead and do the procedure. Sir, and first things first is I would go ahead and explain the procedure to him just to make sure he knows what's going on. Sir, I'm just going to do a catheterization on you to make sure. It seems that you're having trouble voiding, so this should help void out any urine, and you should feel a lot better. So I just kind of want to explain the procedure to him, and then I would also ask, sir, do you have any allergies? Because if he does have any allergies, such as being allergic to iodine, then I would want to use something else as a disinfectant or cleanser for him because of that allergy. So once I've asked that, then I would go ahead and move this bed to the highest position. And I want to do it just about waist level or elbow. I think that should be good right there. And then even before doing this procedure, I would have first performed a bladder scan to make sure that he had at least 200 milliliters of urine, because if he did have more, then I would want to make sure to do it quicker to be able to help him void. And so once I've done that, then I would go ahead and pull this side down. Okay. And then I want to make sure to give him as much privacy as possible. But before, I would first perform hand hygiene. I would have done that even before, once I entered the room and before making any contact with the patient. So I would go ahead and perform hand hygiene, and I would let it dry. And I would just tell him, sir, I'm going to go ahead and just inspect your abdomen just to make sure that you're not in any pain. Maybe look for any scars/lesions. And I would go ahead and ask him and I would go ahead and tell him I'm just going to go ahead and lightly palpate. Ask him if it's tender at all as I palpate very gently. And he'll say no, or he'll say yes. And depending on that answer, if he did say yes, then I would want to go ahead and note it in his chart and notify the healthcare provider. But since he isn't in any pain, then I'm going to go ahead and get his legs up. And if he could help me, then I would go ahead and ask him if he could see how much movement he can do during the procedure, so that if he could help me lift his legs, then he would. So I'm just going to go ahead and lift him. And as I said, I want to give him as much privacy as possible, so I would go ahead and cover his abdomen area. So now that I have that done, I would first go ahead and take this, and I would go ahead and ask the patient if it's okay if I put it on his bed, and he would most likely say yes. And I would go ahead and pull it there. And we're just going to save this because this is going to be my little trash bin during the procedure. So I would just put this there. And then I would go ahead and lightly, touching the 1-inch corner, I would want to go ahead and have gloves on, so I perform hand hygiene again and then put gloves on. And I would have touched only the 1-inch corners. And as I would have touched the patient, when doing and inspecting the patient and doing any care to the patient, I would have performed hand hygiene and worn gloves too. But since now that I've done that, then I'm going to go ahead and perform hand hygiene one more time, and just let it dry. And then I would go ahead and put on gloves, and then with the warm cloth that I would have here, I would go ahead and clean the meatus and then down the shaft, just to make sure that I cleanse before doing any procedure. And so with donning gloves on before performing hand hygiene, I would go ahead with my warm cloth. I would go ahead with this hand hold the penis, and then with this hand, with the cloth, I would clean around the meatus with each new fold in the cloth and down the shaft. So I would go ahead and hold it and then down the shaft and clean it, just to make sure that I get any visible dirt or anything that might be under there, and I would go ahead and discard that. And then once I've done that, then I would go ahead and perform hand hygiene one more time, and then put my gloves on. And so with my clean gloves, I would go ahead and ask the patient if it's okay to put my gloves on his bed. But even before that, I would have first performed hand hygiene one more time, and then put on a new set of gloves. And then with this, I actually had it skipped my mind to even before cleaning him in his private area, I would have put this blue pad down to protect the bed from any fluids or any leakage that might occur. But we'll just say that I did that since I forgot to do that. And then, so once I would have cleaned him, then I would have performed hand hygiene one more time, put clean gloves on, and then with this syringe right here, this is just to numb any area and any pain that he might have during the procedure. Sometimes this can be very painful. So with this hand, I would have grabbed his private area, and then I would have inserted the syringe and the solution, and that would have numbed the area to help him. And so then I would have discarded that. So now that I've done that, then I'll go ahead and perform hand hygiene one more time. And then now it'll be time to put my sterile gloves on. So I'll go ahead and just start that process. And there are gloves in the container for the catheterization kit, but since these are my gloves, I prefer these. And I can touch the outside of it, the outside one corner. So just go ahead and discard that. Since my hand did touch I would have made sure to have enough space. So as you can see, the side of my hand did touch the side of this container. So I would have go ahead and thrown that away and grabbed a whole new one and performed the whole procedure again. Since my hand did touch the side of it, which it would have made it unsterile. But I will say that I'll go ahead and would have grabbed a new one. So as I'm donning my sterile gloves, I'll take my non-dominant hand. With this, actually, I'm left-handed, so go ahead and put these on first. And I want to use the hitchhiker method, so I don't I'm touching this outside of the glove, so and it seems like I'm stuck. So I would have Once I have my other glove is when I'll go ahead and fix the other side. So I want to take these fingers and go inside the glove since this part is sterile. Ideally this side would have not touched the sterile glove, but since it is sterile, so with this hand I'll go ahead and... Okay, so now that I'm sterile, with this hand I'll go ahead and fix the and I'll go ahead and reach inside, not touching the inside of the glove. But since I'm pretty covered, so I'm good. I'm now sterile. So I can go ahead, since this part inside is still sterile, I'll go ahead and throw it away. So now that I am completely sterile, then I can go ahead and touch the contents in my thing. So I'll go ahead, I'm not going to need these, so I can just put these to the side. Oops. So as you can see, it did fly out of the container, so again, I would have grabbed a whole new sterile kit and I would have donned on new gloves, so I would have restarted the whole procedure. So this, I just kind of want to, this is where the urine is going to go, where I'm going to collect it, and I'll put the date, the name, the patient's initial, my initials, and I'll send it to the lab right away. So I'm just going to take this. I first want to go ahead and grab this. And since I am still sterile, I can go ahead and grab the outer edges. So I'll go ahead and move this, because I want to put this underneath. The patient. Alrighty. So now that I've set that up, then I would go ahead and I would first take one of these, and as you can see, they were open, but they would have been unopened. And then I would go ahead and start trying to set up my procedure. Oops, so this is backwards, I'm going to do this way. So I just want to go ahead and stick this into the lubricant, because this is going to help ease the entry into the urethra. So I would just put that in there. Seems like I'm having... Okay. So I just want to keep that in there, and I'll leave that to the side. And ideally it wouldn't be open, so I wouldn't have the lubricant on my gloves. So I'm going to go ahead and open this up, and I'll put this cup underneath, because that's where the urine is going to be collected. So once I do start cleaning the penis, I don't want to let it go, because that's going to be my dirty hand, basically. So I'm just going to grab one of these. And I would go ahead and clean around the meatus and down each shaft. So I'll just go ahead and clean. And then I'll go ahead and discard that. discard that. And then I could go around the meatus again. And then down. And then I'd go ahead and discard that. And then I could put that in there as well. So now that I've cleaned his perineal area, then I would go ahead and start the catheterization process. So with this hand, I would want to go ahead and hold the penis, and I would not let go. And then with his hand, I'm going to go ahead and take the catheter, and then I'm going to go ahead and start the process of placing it. So now that it has lubricant in it, I would go ahead and first tell the patient to relax and act as if he's going to void. So I would just go ahead and say on the count of 3, and then just relax. So 1, 2, 3. Relax, 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 relax. And I would continue until I started to see urine. And so now that the catheter is inserted, if for any reason I felt that there was a blockage, or I wouldn't want to push it in any further because that could damage the bladder or any lining of the bladder. So I would go ahead and wait until some urine was collected. And once he was done, then I would go ahead and tell him, okay, sir, just go ahead and take a deep breath and relax. And then I would go ahead and start the process of removing it. So, okay, sir, go ahead and relax. 1, 2, 3, and then I would slowly remove it. And then I would go ahead, and I would probably have left it in a little longer just to see if any more urine was collected. And then I would go ahead and put this to the side. So now that I've done that, I would go ahead and, since it is now out, then I could go ahead and let it go. There's no danger of it slipping back in or slipping back out. So once that I've done that, I would go ahead and take this. Ideally, the cup wouldn't have fallen, because then it would have gone everywhere. So I would make sure that it's balanced and didn't fall anywhere. But for the sake of saving equipment, I'm going to go ahead and save this. But ideally, I would have thrown this away. I would have cupped it in my hand. I would have taken off my gloves. These gloves first. I'll just go ahead and demonstrate. And then I would have taken these gloves, this other hand, and remove my gloves. And then, since we are saving it, I'm going to go ahead and just leave it to the side. But ideally, I would have discarded it. And so once I was done, then I would go ahead and perform hand hygiene. And then with clean gloves, I would grab the solution from the side, and then I would have closed it, and then I would have dated it, and the time, the patient's name, my initials, and then I would have sent it to the lab right away. While I would have done the catheterization, I would have looked at the color, the odor, and the consistency of the urine to see if there was any infection present or just any abnormalities, and I would have let the primary care provider know. And so I would have sent this to the lab right away. And so I'll just leave that to the side. And then now that I've completely done with my procedure, I would go ahead and start removing everything. But since we are going to save this, I'll go ahead and just leave it to the side. I would have discarded everything. So here's my trash, but since I'm saving it, I'm just going to leave it to the side here. Once I'm done with this procedure, I would finishing cleaning up. If I had to do any cleanup of the patient, then I would have go ahead and perform hand hygiene, put gloves on, and then done any finishing cleaning up of the patient if I needed to do. I would have asked the patient if he felt any pain in the procedure, and if he didn't, then I would go ahead and document that. Then I would go ahead and put his legs down. Make sure he's comfortable. Go ahead and cover him back up. And then I would go ahead and ask him if he needed anything. I would also assess any vitals if he was maybe not feeling well, or if he had any discomfort with the procedure. I would go ahead and document that. And then I would go ahead and put his bed down to the lowest position. And so now that it's down to the lowest position, I would ask him if he wanted to be, if it was okay in his chart to do so, to keep him elevated at 30 or 45 degrees. But let's say he just wanted to sleep supine, so then I'd go ahead and leave him. And then I would ask him if there's anything else that he needs, and if he says no, then I would go ahead and perform hand hygiene. And then I would go ahead and discard of everything, perform hand hygiene one more time, and then leave the room.